Let your unique awesomeness and positive energy inspire confidence in others. Good evening and a very warm welcome to everyone gathered here. Clinical Nursing Research Society, South Zone, in association with Department of Psychiatric Nursing, DIMHANS, Dharwad, is delighted to organize a webinar on the occasion of World Mental Health Day 2023. I, Dr. P. Shubhasurya, Secretary of CNRS South Zone, is going to be the master of ceremony for this webinar. Without further delay, let me come to my responsibility. In the recent years, there has been increasing acknowledgement towards mental health, as illustrated by the inclusion of mental health in the Sustainable Development Goals. Depression is one of the leading cause of disability. Suicide is the fourth leading cause of death among 15 to 29-year-olds. People with severe mental health conditions, they die prematurely, as much as 2 decades yearly due to preventable physical conditions. Despite progress in some countries, people with mental health conditions, they often experience severe human rights violations, discriminations, and stigma. Many mental health conditions can be effectively treated at relatively low cost. Yet, the gap between people needing care and those with access to care remains substantial. Effective treatment coverage remains extremely low. The World Mental Health Day is observed on October 10th of every year. The World Federation of Mental Health formally created the day in the early 1990s. According to WHO, the day provides an opportunity for all the stakeholders working on mental health issues to talk about their work and what more needs to be done and to make mental health care a reality for people worldwide. And this year, 2023 theme focuses on mental health is a universal human right. Yes, it is our responsibility to raise awareness and drive actions that promote and protect everyone's mental health as a universal human right. Now, let me introduce today's speaker, Dr. Srivani Rentala, Principal, Vice Principal, Dharwad Institute of Medical Sciences, President CNRS, Professor and HOD of Psychiatric Nursing, Dharwad. She is the recipient of Florence Nightingale Award 2015. She is a fellow of Indian Society of Psychiatric Nurses. She has authored many textbooks in psychiatric nursing, psychology for nurses, nursing research, and many more. She has also published more than 50 research articles and she has participated as a resource person in more than 100 seminars, conferences, workshops, and webinars. She is also a PhD nursing guide under National Consortium and she is a principal investigator in national and international projects. It's my pleasure and proud privilege to invite Dr. Sreevani to share her views on mental health and mental health illness, role of a nurse. Madam, over to you. Participants, please note question and answer session will be taken at the end of the sessions. Over
Yeah.
to you, ma'am.
Yeah. Thank you, Dr. Shubhasurya. And dear organizers and South Zone members and dear participants, a happy good evening to one and all. I wish all of you a happy World Mental Health Day, and I pray God for everyone should have a well-being and we should lead our life happily and healthy. Okay, let's start my presentation. Yeah, is my screen is visible?
Yes, ma'am, it is.
Yeah.
Yes. Once again, I welcome all the participants for this half-an-hour webinar. So today you all know that it is World Mental Health Day. This day, the theme is mental health is a universal human right. The caption is our minds, our rights. I'm not going much in detail about this one, and another speaker will speak on that. And I will be giving a basic concepts of mental health and mental illness. So let's start my presentation with the prevalence and the incidence of psychiatric disorders. This is the latest publication, 2016 National Mental Health Survey as conducted in India. It says that 13.7% prevalence of mental illnesses. So 28% of global suicides are occurring in India. When we look such a huge prevalence, but we have only 49 people are having access to mental health facilities within the 20 kilometers. So the 26% reported that mental health facilities are within 50 kilometers radius. 59% reported that they lack any de-addiction service in this area. Awareness about mental illness. 57% people do not aware about the mental illness things. 28% did not consider suicide to be associated with the mental illness. And when it comes to the insurance policy and all, 80% had no health insurance or thought that mental health things are not covered in the insurance. So let's talk about the mental health. We all know the definition of mental health. It is a state of balance between the individual and the surrounding world, a harmony between oneself and the others, and it is a coexistence between reality to the self, others, and the environment. So there are some criteria are there. The person should have to say he is a mentally healthy, he should have an adequate contact with the reality, can have the ability to control his thoughts and imaginations. Also, he will be efficient in his work and play. His behavior is socially accepted and he has a positive concept about himself, and he has a healthy emotional life, controlling his emotions. When it comes to the mental illness, the person behavior is causing distress to himself and also to the others. Apart from that, day-to-day activities, his behavior is disturbing and also job is unable to perform. So WHO very long back this definition has given. When we consider as a mentally ill person, he has alterations in thinking, mood and behavior. Along with that, he has a personal distress and impairment of functioning. So what are all the characteristics of mentally ill individual? I'm not talking about the healthy people. We know everything. He has a first changes in the thinking. Okay, once the changes in the thoughts, then mood will be altered. Mood is altered means automatically behavior will be altered. Then apart from that, he also have a disturbance with the cognitive function, that is a memory, perception, judgment, and which appears to be, his behavior appears to be deviant from the normal thing. Though the person is suffering with the mental illness, he also have certain physical disturbance also. Most of the time, these mental illnesses start with some disturbances with the physical things. Like first and foremost thing is disturbed is the sleep. Next one is the appetite. Either it can be increased or decreased. Bowel and bladder disturbances in some cases. Sexual desire and also activity. So what are all the psychological disturbances the person will be having? He has a thought disturbance, speech, emotion, behavior, perception, attention, intelligence. In certain conditions, level of consciousness also will be altered. What happens to the social activities? He neglects his bodily needs. He neglects his personal hygiene. He behaves strangely with the family member. Sometimes he abuses, assault to the family members also because of his suspicious behavior. Sometimes apart from those things, some people will have only aches and pains in the different part of body, complete fatigue and weakness, and some kind of involuntary movement. Even these things also sign of mental illness. We have a various types of mental illness, like starting with anxiety and depressive disorders are the highest prevalent, bipolar affective disorder, schizophrenia, eating disorder, obsessive compulsive disorder, and sleep-wake disorders. Common sign symptoms, I already explained all those things. Now we will see how we will recognize these warning signs in the children, adolescent, and adult. In the children, the symptoms are entirely different. They have a changes in the school performance, poor grades despite strong efforts, excessive worrying and anxiety. The child will be very hyperactive, persistent nightmares, persistent disobedience, aggressive behavior, frequent temper tantrum. So we all should know that even these things are sign of poor mental health in the children. The child required immediate attention. So adolescent, when the problem is starting, means first and foremost thing, these people will addict to the drugs or alcohol because unable to express their problems. They have a changes and eating habits, excessive physical complaints. They will skip the school, stealing for these drugs and alcohol, damaging the property with abusive and assaultive thing. and intense fear of own that weight gain, long-lasting negative mood along with the poor appetite and thoughts of death, frequent outburst of anger. So these symptoms also entirely different. When we come to the adults, confused thinking, long-lasting sadness or irritability, little specific symptoms we will see in the adult group. Excessive moods like a change of the extreme highs or low mood, social withdrawal, dramatic changes in eating and sleeping habits. They have a delusions and hallucinations, thoughts of suicide, many unexplained physical problems also. They also have drug abuse and alcohol. So we have to identify these cases in the community. When you visit a school or when you visit a community, when you visit a house, you observe for these things. The person who talks nonsense and act in a manner it considers very strange and abnormal, sometimes who have become very quiet and not mixing with the others. His behavior was not like that. Suddenly there is a change. And who claim that they are hearing the voices others are not hearing and they are seeing some things which others are not seeing, who are suspicious and they claim that somebody is trying to harm him, cheat him, persecute them. Then some people know all of a sudden they will become very cheerful and they crack the jaws. They say that they are very wealthy, superior, and really they may not be having that ability. Who became very sad and crying without any reason, and who talks about the suicide, have made an attempt to suicide. This is also very important. Most of the time, this suicide behavior is associated with the major mental illness. It can be a depression or a schizophrenia or maybe other mood disorder he may be suffering. So we have to recognize the underlying problem. Some people who get possessed by the god or spirit and who are said that they are victims of the black magic or evil power, these are also signs of mental illness. Who are dull, mentally not grown up like others of their age, and slow since birth. This comes under IDD, intellectual deficiency disorder. So when you find these things in the children, adolescent, and adult, so first thing what we have to do, early identification is very, very important. And if you find these kind of things, immediately refer the cases, give education that mental illness is also like a physical illness. Treatment can really help. Provide counseling to visit to the hospital. Do the follow-up once they go to the hospital, whether they are continuously taking medication or not. Utilize the community resources if they have a PHC nearby and there the psychotropic drugs are available, make arrangements. Provide rehabilitative services within the community if they have some chronic problem, community rehabilitation centers. Okay, I just basically covered on the basic concepts of mental illness, how we have to recognize. In a briefly, I told nurses' responsibility, what we have to do when we find these cases in the community. Okay, just two questions I have made as a review. Which of the following is the criteria for mental health?
Option B. Option
It is a criteria for mental health.
Option A, efficiency in work and play.
Yes, option A is the right answer. Which of the following is an important characteristics of a mentally healthy person?
ability to make
Ability to make adjustments.
Very good, very good, very good. Yes, this is the how
Option
we are
B.
to. Yes, option B is the right answer. Yes. Any question? We will have a question answer session at the end. Thank you for your patient listening. Then I can ask the organizers.
Yeah.
Over to
So,
Dr. Surya.
yeah. Ma'am, it was wonderful and very crystal clear. We do not have actually doubts. Thank you, ma'am, for highlighting the importance of mental health, and it was mind blowing. We could able to understand the basic concepts of mental health. Now, let me introduce the next speaker, Mr. Srinivasan, Treasurer CNRS, Assistant Professor of AIMS College of Nursing, Mangalagiri. He is a PhD scholar. Can you please mute? Mr. Srinivasan, can you please mute the people? Yes. He is a PhD, Mr. Srinivasan is a PhD scholar from National Consortium by Indian Nursing Council. He has in total of 16 years of teaching experience and worked at various institutions all over the India. He has a total of 41 research publications to his credit in various national and international indexed journals. Yes. He has participated and presented research papers at various national and international conferences. He has a rich experience in psychiatric nursing in the field of psychiatric nursing, research, and statistics. He has
We can't mute.
Mr. Srinivasan, can you please mute them? You have an option as an admin. You'll be able to have an option. Kindly mute them.
I have already done it, ma'am. People are joining from mobile phone, which was not able to mute.
Okay.
There are few people are joining from mobile phone, which is made already while joining. It is auto mute. There are people who are joining from mobile phone. They are coming with that. So I'm muting. I'm trying to do it. So it's done already.
Sorry for the interruption. Mr. Srinivasan has got an expertise in handling internal quality assurance cell, master trainer for quality improvement projects, and handling reference manager softwares and statistical packages. He is also a master trainer for promotion of mental health of healthcare providers during COVID-19 pandemic. I feel he is the right person to speak about the significance of World Mental Health Day. Over to you, Mr. Srinivasan.
So is my slide visible?
Yes, it is.
Okay. First of all, thank you so much, first of all, Shurya ma'am, for introducing me. And it's really a privilege for me to be here and to discuss about the significance of this year Mental Health Day theme. So I think already Dr. Srivani madam has already discussed most of the things about the general aspects of mental illness. So it's easy for me to discuss only about the theme. So let us see what we are going to discuss today. So the objectives are only two things we're going to discuss, and we are going to reveal the theme, and then we're going to discuss about the significance of this year World Mental Health Day 2023 theme. So this is before beginning with the theme. Let me talk something about World Federation for Mental Health (WFMH). So World Federation for Mental Health is the organization who has actually initiated and who has been conducting a campaign since 1992. And World Federation for Mental Health is the organization which is giving every year the World Mental Health Day theme. And they work towards the theme. Every year they have a theme and they work towards it. So to talk about the history of World Federation for Mental Health, 1948, the organization was founded. And exactly this year, 2023, it is 75 years it's been completed. And that is why this year campaign is a huge campaign. And they are going to conduct it for more than for 15 weeks. They have planned to organize this campaign this year. So since 1992, every year they are having certain theme and they are discussing towards it. And this year we have a theme of mental health is a human rights. So let us see what is Mental Health Day theme for this year. Mental health. I think
please tell them, sir.
Few
Please tell them,
participants
sir.
are there. Please mute. Please
Yes,
mute
sir.
yourself.
Thank you.
There are few participants. Please. Okay, this year theme is World Mental Health Day theme. Is mental health is a universal human right. It is a universal human right. Mental health is not just a privilege; it is actually a human right. That's the concept you're going to discuss. So why this theme has been chosen this year? To be honest, to see good mental health is vital for overall all the health and well-being. It's a good vital mental health is important for all the countries, especially for India. Yet, 1 in 8 people globally they're suffering from mental illness. 1 in 8 people means there is a huge number suffering from mental illness. And you take about the facilities available for the mentally ill people are very less in number, including the government hospitals, the private hospitals, the bed availability for the patients as per the patient bed ratio. We have some restrictions. We keep patients for 90 days. We discharge them so that we can treat some new acute patients, those who are suffering from mental illness. So there are a lot of questions comes in our mind. That's the reason that this theme has been chosen this year, to give an importance that it is a human right rather than calling it as a privilege or something. So mental health conditions are also affecting not just 1 in 8 people, especially a younger generation. People are getting affected much with mental illness. So this has a high significance to India because we have a huge youth in number in our population. So that is the reason that World Health Organization said that it is continuously working with its partner. The various partner, where various organizing agencies are there, they are working with them to identify how well the mental health has been valued. So to bring some kind of a value in society, and mental health need to be promoted, and they need to protect them from any kind of a mental health risk. How it can be done? We need to bring some kind of an urgent action. So WHO emphasizes we have to bring some kind of an urgent action is taken so that everyone can exercise their human rights and access to the quality mental health care, whatever they need. So the highest importance is given that it is not just talking about mental illness or mental health. We have to make the people understand that they will be getting the good quality care. It is their right rather than just going and expecting somebody to give a care. So it is their right. They can claim it. So it is their responsibility to. And to see the significance, already I spoke, this year theme is always related to the mental health is a human right, universal human right. Whoever it may be, everyone, wherever they are, they have certain kind of rights for highest attainable standard of mental health care. Highest attainable standard means we have to talk about three type of a right here. What is that? First right, right to be protected from the mental health risk. People are suffering from a lot of, there are vulnerable groups are there are risk stages are there who will be easily getting into mental illness. As much as possible, the primary prevention should be strengthened so that it is a right for the person so that they can be protected from all type of a mental health risk. Second right is the right to available, accessible and acceptable and good quality care. Everybody is having the right to get an accessible care. Easily they should access to psychiatric care. Easily they should have an access to the good quality of mental health care. So we have to strengthen the community mental health services, and voluntarily we can donate the voluntary health agencies or mental health organizations, NGO organizations, so that they can improve the quality of care, so that they can make it available to each and every villages. That is the concept this year the theme is focusing on. And final thing is that it's a right to liberty and right to independence. And though if I'm suffering from mental illness, if I got recovered from the mental illness, I need to be smoothly transitioned from the hospital to the community. I should be welcomed by the community. I should not be discriminated on any basis. So that is the thing that they mean to say, that it is the right of the person to get treated from the mental illness and then go back to the community and live as he lived before getting into mental illness, before the morbidity phase. So these are all the rights we need to focus on. It's very clear. It's not just giving a treatment to the person. We are giving a respect. We are giving completely the whatever the Mental Health Act has spoken about the human rights in Indian concept. I mean to say that, so that all the rights is been taken in this year theme, and they focused on right to be protected from the mental health risk and right to available all the accessible and all the good quality mental health care. And it is a right for the person to get treated from the mental illness and then go back and live in a community the way how you lived before getting into mental illness. So these are all the areas the significance focuses. So come to the objectives of this theme, this year theme, as I told that overall it aims in improving the knowledge. We have to improve the knowledge among the people. What is mental illness? What are the risk factors? That's what already madam spoke about it. What are the poor warning signs or something? Why means we should not discriminate them. So it is their right to be treated like a physical illness. As we are treating the physical illness, they should not be discriminated on any basis. So we have to improve the knowledge and we have to raise the awareness. And once the awareness is increased, then we need to drive actions towards it so that we can promote and protect everyone's human right. That is the overall aim. If you split this, the first aim into two objectives, these are all the second and third point you can see here. So we have to raise the awareness of mental health issues around the world. It's not in a single place or somewhere. Whole country, a whole world is working towards it. And it's going to be a huge campaign by World Federation for Mental Health to mobilize the efforts in order to support the mental health as much as possible. And second, now this theme gives some kind of opportunity for all the stakeholders who are invested in mental health care. All the stakeholders are getting some opportunity to put forth their point of view. They can clearly tell that how much they spend and what they got benefited out of it, what else they're planning to do in future, and what kind of a supports they need from the government as well as from the other organizations, voluntary agencies and everything. They can clearly talk about it, which is a good sign that these are all the two major objectives of this year theme. So we need to raise the awareness so that we can mobilize the good efforts to support the mental health, so that equally the care can be given and everybody is having a human right to access to the good quality of care. And second, whoever is involved in investing this mental health or mental illness or mental health care, they have an opportunity to raise the point, to talk to the government, to put forth the point of view, and so that the government and also can take some initiation. They can collect some funds and other things, so that increase the strength of the mental health care facilities available in the country. This is the objectives. So now I think that today we are conducting this webinar on behalf of CNRS as well as Dharwad Institute of Mental Health and Neurosciences. So in collaboration, it is not just a celebration. Now we are actually, what we are doing today, Madam also spoke about the session I am speaking. This is just to increase the awareness. Just did an awareness, but it can be celebrated in a different way. The different way, I could say that why this theme has been taken, how you can celebrate it. First thing, educate yourself. So you have to learn yourself about the mental health and mental illness, because you can confidently say that you are not physically ill, you are free from all kind of physical illness. But you cannot say confidently that you are free from any sort of a stress or any sort of a mental illness at any given time. You will be always under some sort of a stress or some sort of an anxiety. So you need to learn yourself about the mental health by going through all the online materials. All the new government websites are having a lot of modules also to understand about the mental health and mental illness, as well as the importance of yoga, meditation. There are so many things out there that you need to do. This is the first way to celebrate this. I think that is the first way to celebrate this World Mental Health Day. Second is talk about it. You have to openly talk about your mental health and mental illness or signs and symptoms, whatever you have. Openly, you talk to your friends. Openly, talk to your colleagues, your family members, your therapist, or any trusted individuals. That is the second way. And third is the community involvement. Already I told you that we have to talk to the stakeholders. Stakeholders have got the opportunity this time. They are going to, for their point and all the views to the government, they get to know how much fund has been spent on this mental health care and what kind of support they need. So what we can do, instead of celebrating simply, you can contribute to these NGOs, all the mental health organizations. So what is possible from our end? We can spend even a smaller amount also. It is good for for agency to spend on mentally ill patient. That's the third thing we can do it. Community involvement. Voluntarily try to contribute some amount to these organizations, so that we are also contributing ourselves and we are also involved in celebrating this theme. And finally, everything is next. First is your own mental health. So focus on your own mental health, self-care, prioritize about your own mental health, and have adequate sleep, do kind of a regular exercises and relaxation, and connect with people whosoever you love, significant people. So all these things you can do it, so that you can improve your own mental health. To conclude this, I can generally say that this year the theme is that it's mental health is a universal human right. Universal human right means patient has his own right to get an access to all the good quality mental health care. But it is not just that. You have to contribute for it. And webinar is one part we are educating now. So this concept is already covered now. You got some kind of an idea. Now you can talk about it. You can talk to your friends. You can share this information to others. You can tell them that how this mental health can be improved, what are the fund is spent on it, and what facilities we do have it, how it can be improved in community areas. And from our side, voluntarily, we can contribute some amount or something to the agencies or community mental health services, whatever has already been done in our country, so that we can give a good quality care to the patients. We are also contributing ourselves in the this human right. And finally, look for your own self, your own mental health. That's also important. So the take-home messages you see, as I already told, that good mental health is an integral part of any country or any society. It's very important to improve the well-being of the person. So this year theme is very clear. It is mental health is a universal human right. It is not a privilege. It is a right. They have a right to ask for a better treatment. You have to provide it for them. So for that, the government and the stakeholders should come forward to collect the money and do something. And they have to make all the facilities available for the psychiatric patients. And third thing that already told you, India is a young country, so where the youngsters are more in number, adolescents. So mental health conditions are increasing among the adolescents. So we should be very careful that whatever the theme is celebrated by World Federation for Mental Health, it is applicable to India also, because we are going to have a n number of mentally ill patients. And next thing already told you, improve the community care. to improve the community care, you can spend, you can contribute, or you can share your knowledge to them, or even you can voluntarily donate the money to the agencies, those who are working for mental health services, so that it will improve the right for the person. So that money is there, then only service can be given. So the person can easily get all the accessible care. And finally, already I told you, any mentally ill patient, they have a right to suffer from mentally ill, and they have a right to get a proper treatment, and they have a right to go back and live as normal as they lived before suffering from mental illness. This is a final point, that never ever show the stigma or never ever try to discriminate, because it is their right to come and live with you as they lived before. So thank you for giving this opportunity to me. I think that I made it clear about the theme, and in a just whatever the time I had for 10 minutes. So thank you. If anything would like to contribute, anything would like to know, you can put in the chat box. It will be answered later. Thank you. Thank you so much.
Thank you, Mr. Srinivasan, for emphasizing on whomever and wherever they are. They have the right to the highest attainable standard of mental health. And that was brilliant and brave presentation. We could able to clearly achieve. Audience, any questions? I'll take up few questions. So, what are some government modules which talks about mental health care in India? What are some government modules which talks about mental health care in India?
Yeah. Government modules you are telling? Yes,
Yes,
DIMHANS have prepared many manuals, especially on alcoholism manuals are there. That is relapse prevention then, and also tobacco cessation, that manual also available, and also for the primary health care doctors, nurses, and also for the multi-purpose health workers. Many modules and e-modules also they have prepared. National Institute of Mental Health and Neurosciences, in their website they can get, or sometimes maybe those things are also attached to the Ministry of Health and Family Welfare also.
fine. No. Some more
I think
voluntary agencies.
to add on
Sir,
that, I think
yes,
the
please.
district mental health program also has developed a lot of e-modules which is available, and even the community mental health centers also, they extended the e-models for suicide prevention, which has recently been taken by the government. A district mental health program also is doing it.
To add on
So
this,
some, yes,
may I contribute? Yeah.
Yes,
To
please,
add on
please,
this,
please.
the mental health nurses to self-care, as well as the module for caring for the patients. A module has been prepared under the collaboration with the WHO by DIMHANS Nursing Department. So that is available, and that can be used, and it is copyrighted, and it can be the authorization can be addressed, so that citation can be done. So the free copy is available on the domain. Thank you.
thank you, thank
I
you.
think we have only 3 minutes left. So thank you, Mr. Emmanuel, for contributing. And they were also asking about some voluntary agencies. Some more regarding voluntary agencies that is contributing to mental health. Any comments?
Yes, there are so many voluntary organizations are there, especially in the rehabilitation centers, halfway homes, quarterly homes, helpline centers. All those things are in the with the voluntary organization. We have a SCARF, that is schizophrenia thing in the Chennai. Like that, self-help groups also under the voluntary organization.
Hi, ma'am. I would like to contribute. The DIMHANS module name is Suraksha. It is, you can search in the way of Suraksha, where you will get this along with the, this is done along with the Karnataka government, and the module name is Suraksha.
Thank you, Dr. Valliamal, for contribution. And thank you, ma'am, Dr. Srivani, ma'am. So shall I wind up the session? We have only 1 minute more. So, good mental health is vital to our overall health and well being. Let us strive to achieve the theme. This initiative, this webinar is been completely organized to enhance understanding, increase awareness, and encourage steps that support and safeguard the mental health of all. Thank you, CNRS team and Department of Psychiatric Nursing, Dharwad, for enlightening us with your kind and insightful words. We appreciate you for enriching our event with your kind presence. Thanks to one and all gathered here for giving us your prized time. Bye for now. See you soon. Have a great evening. Thank you.